the health of an Aboriginal person and the social and emotional wellbeing of an Aboriginal person, they really aren't that different. It goes hand in hand. If their health is down, then that can affect their social and emotional wellbeing and vice versa. So at VAHS, we have a holistic approach to health and we consider all aspects.
It's like a big meeting place for everyone to come here.
It was not only a health service, but a community connection service.
VAHS has always been seen as a home away from home, so we still try to reflect that. Our hospitals do a great job, but they're very, really busy, and you can get lost in that. It's all those wraparound things and holistic health that we do, even to a point sitting down and having a cup of tea.
A lot of our mob, especially our older mob, have a lot of trauma around entering healthcare settings. So when, as an Aboriginal community controlled organisation, we're able to really offer that service, and our clinicians are able to take the time to build that trust and build those relationships, then the community, they just feel heard and they feel like it's a really safe space.
Aboriginal community looks for an Aboriginal worker and they feel comfortable with them.
The funding through the department is the strengthening the lifelong Aboriginal health and wellbeing through access to early intervention and holistic care initiative. This has been a fabulous program to roll out. The ability to respond to more of our people now is a huge outcome. It helps us deliver more health checks. It enables people to come after hours. It enables more phone contacts. It helps us with our ability to respond to people's needs.
Because of this initiative, we have been able to increase our health checks by 14%, which is great because health checks, they aren't just an easy little assessment that needs to be done. It takes a minimum an hour and a half.
The health worker will sit down with someone first and do a really long health check and story, and then they'll see the GP after. And it doesn't matter how well someone is, there'll always be something that pops up in a health check. So the health checks remind you if someone's had their immunisations, it'll check their blood pressure, doing someone's asthma action plan, making sure their diabetes is under control. So reducing the risk of someone having a heart attack or a stroke or a vaccine preventable illness and ending up in emergency.
You know, I go in every fortnight and I have all the regular tests that I need. That's what our people need to do. They do need to see a doctor regular, but they do need to have a plan ready for themselves so they can look after themselves instead of going into hospital.
The funding's been really good. It means we've started the Saturday morning clinics again. Having done them, everyone's so happy that they're on. It's meaning that it's not left to too late, or going to a clinic where someone doesn't know their problem or their story, or going to emergency because they couldn't come in here. On one of the Saturdays, I think there was 7 people out of the 9 that we saw that didn't have to then go to emergency. We knew their story and could sort the problem out before it became a bigger problem and it needed to go to emergency.
I've noticed as a practice manager that our clients just feel like we're listening to them and that we're just adapting to the needs of the community. They appreciate that we're then working after hours or working on weekends. They appreciate that we're taking more time to follow up any recalls or follow up on any healthcare needs.
With the community, they feel more comfort in knowing that they have a health service there for them, and you feel the love and the culture. And what more do you need?